Hello, it's Guy coming back to you. It's April 4th. Um, I had my surgery on December 27th. I actually did a video again on December 30th after my surgery. Now it's been quite a while. It's been about 4 months, and the reason for that is I had a complication. I actually had a gastric leak. The gastric leak was detected on January 6th. I went, I wasn't feeling well, had a fever, and went into radiology, had a CAT scan done, and they found out that I was leaking. So I went in the hospital. They had to put a drain in me to drain what leaked out. And then I went on what's called TPN, which is IV. So they had to put a PICC line in me. I was in the hospital for 6 weeks. So a long time. The TPN, the total protein nutrition, a little high in calories, so I didn't lose as much weight as I wanted to. But it was quite a journey. I actually had a stent put in my stomach to hold it together. And then after I got out of the hospital, they let me go home, and then I had nurses come, and I had the TPN delivered through my IV for 16 hours a day. I was connected to IV. And of course, I had my drain in me. It did stop draining for about 3 weeks, and then had my stent removed. Then about 3 days after my stent was removed, all of a sudden my drain started showing fluid again in it, and my drain actually poked a hole in my stomach. So now I had another hole in my stomach, but this time did something a little different. I had an interventional friend that I called and spoke to him, and we came up with a solution of using BioGlue, and I was the first patient this was done on. So they did put BioGlue. It sealed the hole. I waited for about 3 days and started to drink and eat, and everything was fine. Then 2 weeks after that, I went back to work. So it was nice to get back to work. So I've been back to work. This is my second week back. I'm feeling great. I have a ton of energy. It's funny now that I'm farther away from all the complication part of it. You say, is it still worth it? And you say, yeah, I just have a ton of energy. There's a lot of things, that are tough with this. Eat very little. You feel full quickly. I feel a little nauseous after I eat, but it goes away. Right now I'm doing chicken and some beef, and when I sell beef, I use pot roast. I can shred that real nice. And chicken, I mix up a chicken salad and stuff and eat that. But I feel fine. I'm eating some crackers too, which soothe my stomach. But all in all, again, I'm down 65 pounds. I'm 245. I feel great. Can't complain. The weight's not coming off, I guess, fast, but I notice a big difference. Let's just put it that way. I don't have hip pain. I don't have knee pain. I fit in my clothes better. Matter of fact, I have a whole couple size down. So things are going good. I can't complain. So, but I just wanted to give you an update. I know it's been a while since I did update. I'm not putting all these up until I'm done. Until I actually show a good amount of weight loss, and then I'll put up the videos all one shot. But I just wanted to let you know. So if any of you are worried about complication or anything, just give me an email, and I'll respond back to you. But you say 6 weeks in the hospital, that's bad. That's real bad. It was bad, but again, it's still worth the surgery. And the place that I went to only had a 1% complication rate. I think 3% is the normal that's out there. So they had a 1% complication. They actually didn't even know how to deal with this problem. So I had to go to another hospital, and actually another doctor from another hospital came to this hospital and operated on me. Then I had to go back to him at his hospital. So the stent was placed in by another bariatric facility. So, but I guess they were used to having complications. But my doctor, I stuck with him, and he's very knowledgeable. He went and reached out when he needed help, which was what I consider honorable, because a lot of doctors don't do that. So, again, good luck with your journey, and I'll just keep telling you about mine. All right? Talk to you later. Bye-bye.